and it's not really surprising when you think of all of the globalized context in which we live right now, and then you think of all of the international travels. If you think about what has been the IATA statistics, you can think of about 120,000 planes that are crossing the side of our world every day, and that represents between 200,000 and 12 million people traveling every day. So when you start seeing a pandemic arising like that with a respiratory virus that can spread quite quickly, and then once you realize it's spreading from human to human, then you know that the chance of spreading are incredibly important, and that everyone has to get ready to see what was happening. So learning from China and some of their mitigation measure, I think you can see here that most of the country, even though experiencing this exponential growth, were able to reduce a little bit that rapid growth and that number of cases. So that leaves us in a situation right now where globally we have seen more than 2.5 million confirmed cases as of yesterday, actually, not of April 22, and then this represents about 175,000 deaths, a bit over deaths in the world. So we've quickly come from this small outbreak to reach more than 2 million people being infected, and then this in less than two months. So that's been a very unprecedented spread of an epidemic, and then we're really living through through history right now. When you look at the old world map, you can see that the case have been starting to stabilize a little bit in the Western Europe and Americas, and then what WHO was reporting is that we're seeing an upward trend in Africa and then Central and South America. So when you think of this travel and then those countries that have been highly touched, those are the countries that receive the most international travel. So it's not surprising that the epidemics sort of spread through that very quickly. But now we're seeing that spreading across the rest of the world as well, with seeing continents like Africa as well as Central America having the number of cases rising. This is a bit concerning in that sense that when the WHO declared the public health emergency of international concern as January 13, it was really on the ground that many countries, especially the countries with weakened health systems, could really be strained by this epidemic. So many of those countries, when you have so many cases that arise, and then knowing that was leading to cases of important pneumonia, WHO wanted to make sure that those countries, and then as well as internationally, we were prepared to help those countries dealing with that pandemic that was coming, and then yet we don't see that many cases in those countries, but we have to keep on the watch. So going back to those mitigation measures, I think what is very important is to think how we have to reduce that idea of that exponential phase and really going to that bending that curve thing, meaning that we need to make sure that the number of cases in our country will not be not overwhelm our health system effort, and then will not sort of get into us being able to respond. So to be able to do that, we have to have many solutions that are put in place, and that needs to come from this research perspective. So to really try to identify and answer all of those questions that come from a pandemic, that happens and arise during a pandemic, and then what will be the best way of putting those measures in place. So just to give you a bit of an idea of what's happening in Canada right now, I'm sure you're already aware, but same as the international. So we've reached almost 50,000 cases, and then almost a bit above 2,000 deaths at the moment. And then our epidemic started in January with first travel case, and then we saw, and then we kept monitoring all of this, and then we saw the number of cases starting doubling in March when we started seeing community transmission in Canada. And then so most of our cases have been concentrated in the province of Quebec and Ontario, where we see the highest concentrations of populations and in the biggest city in our country. So getting into what has been our Canadian response. So we're really in this presentation going to focus on that research response, because it's been where we've been really involved, but we have to keep in mind that it's a very multidisciplinary, and it really brings a lot of different actors together. So of course, when we think of putting in place all of those mitigations measures and then taking care of the sick people, it brings together not only the federal governments, but all of the provincial governments, as per health is a provincial competency in this country. So the idea is that we have to coordinate and understand and exchange interventions at a high-speed level between all of those different actors to be able to have a very relevant and rapid and identified quickly what needs to be done, and put it into action. So from the Government of Canada perspective, again, there was very many actors being involved in this response, and especially in this, I will be speaking to the science and research response. So in March, when we identified communities, and then that we move into all of these mitigation measures in Canada, the Government of Canada really called for a whole of a government response. What it means that everybody needs to come together and then put their mandate and expertise to that. So that means that the Public Health Agency of Canada has to provide direction into the health response. Health Canada, which is our regulator, needed to understand and then get ready to approve quickly some of the device, as well as some of the solutions, or get into clinical trials for testing therapeutics. We also had Indigenous and Northern effort that takes care of healthcare within the reserve in Canada for Indigenous people, and then caring for Indigenous people. The Food and Inspection Agency of Canada, as it was a zoonotic disease, and then as well as they can provide expertise around this kind of transmissions. They also run a network of international laboratories. We have organizations that are like the International Development Research Centers that fund international research, and then going back to thinking of helping low and middle income countries into their surveillance, that would be the organizations that is able to provide research funding abroad. Another very important piece of that needs to be brought together is that once you have identified some of those solutions, or new diagnostics, or new tests, or new vaccines, they need to be manufactured, and then they need to be spread to the market. So we need the Innovation, Science, Economic and Development Canada organizations that is able to take care of that piece. We also have the National Research Council of Canada, which is a national research organization, which also has manufacturing facilities and then GMP level facilities that can take on several aspects of the research to develop applied solutions, but also to make that happen on a large scale level. And then finally, Global Affairs Canada was also an important actor within that response, because they fund international development, and then they also take care of the global security aspects of things. And then what you can see in the middle of that slide, and then that's the three agencies. So the three main research funding agencies, the National Science Engineering Research Council, the Social Science Humanities Research Council, and then the Canadian Institute for Health Research, that are the three agencies mandated to fund research. And then when we were speaking about that government research response, we were speaking about all of these different actors coming together and then feeding part into that response. So when you think of how these different actors organize together, what happens during the pandemics of that amplitude is there's so many strategic considerations. There's so many unknowns. People, we understand that there's something spreading. We understand that there's potential for overwhelming the health systems, but there's so many responses that there's so many questions and so many strategic considerations that needs to be answered before we can start. So when such a pandemics come, we need to really understand the virus, and then what types of virus, what is this natural history, do we have the sequence, are we able to make diagnostics, what's the speed of transmission of that virus? We need to understand the epidemiology, where does it come from, what are the public health measures, how you do your contact tracing, and then you need to understand how you want to save lives. So when coronavirus came around, there were no therapeutics. China developed rapidly the diagnostics, but all of these questions are unknowns, and then they need to be fed very rapidly to those different instances that make decisions, so we're able to move forward. And then finally, we need to have new tools that are able to, for helping with preventions of the pandemics, and then lead to the predictions of a vaccine, for example, which is our best idea. And then that's where research becomes so important, and it's really at the forefront of that government response, because it's through research that we're going to start providing those answers, as well as we're going to start being able to develop all of those different tools, like the diagnostics, like the vaccines, like testing those new therapeutics, and then that we're going to be able to also provide clinical guidelines that's going to help our public health response systems, as well as our government, as well as the health system, make the best decisions to be able to inform what are going to come next into that response. So just to give you an idea of how quick we've been at CIHR and how rapidly we've turned into that research response to inform the rest of that response, I'm just going to go through a quick timeline where I can just really highlight to you how these different steps came, and then Charu is going to dive into dissecting all of those different steps. So as early as January, we were already surveilling all of what was happening in the world through some of our different systems. So as soon as January 7, when China confirmed their first case, the Canadian Institute for Health Research was already activating this emergency fund. So after WHO declared the public health emergency of international concern on January 30, we were already pre-announcing that we would put out rapid research response fund 5 days later on January 5th. 5 days later, we were launching a funding opportunities that was informed by the international response to fund for up to $25.8 million of research response, and that's doing coordinations with all of these other agencies that was speaking earlier, especially NSERC, NSHRC, and then IDRC, that all came together to put money together in addition to Government of Canada. And then by February 28th, we were already ready to fund 47 research projects. When WHO declared the pandemic, the Government of Canada came with an additional $275 million to enhance research and development capacity, especially to help towards commercializations of those solutions. And then that amount of money gave us the opportunity to fund an extra 49 additional research projects. And then as we were reaching on April 17, more than 2 million cases worldwide. Yesterday, we announced another $1 billion in support of more research on medical and social countermeasure, and then we launched a $107 million opportunity to do that. So now let's just dive into a little bit more of what has been this domestic response and how we've been informing what it would look like, and then what types of research we needed to fund and how we can do that, use our Canadian strength to really feed into this international needs. So as we were explaining, we were the Canadian Institute of Health Research. So that means that we are the Canadian agency that is responsible to fund the health research. We have to do that towards a specific mandate. So our mandate is really to fund, to excel according to internationally accepted standard of scientific excellence for the creation of new knowledge and its translation into improved health for Canadians. So it means that not only do we distribute money for research, but we also really have to think through, and then we're accountable to make sure that this new knowledge that we create is translated for health impact, and then in this case of pandemic, it needs to be for the health impact of Canadians, but also to feed our international mandates and then to be relevant into helping internationally. So as the Institute of Infection and Immunity, we provide the leadership into everything that relates to infection and immunity, and then that's under our mandates that the pandemics fall. So the model of the Institute has 13 institutes that provide scientific leadership. All of the institutes you can see there, and then for us, when pandemics arise, it's really us to provide the scientific leadership. And providing scientific leadership means that we have to understand that international landscape, because we have to understand where the needs are, what types of research needs to be funded, what are the Canadian capacity, and how quickly can we deliver on that. As a Canadian agency, we also have accountability to the taxpayers that the investment that we'll do will be worth their money. So, and then we also have to report Parliament to demonstrate that we're able to have this impact, and that our investments are well thought through and well done. We also have to advise the Minister of Health, and then we have to support the federal policy direction. So it's really for us to support innovations, but also provide those evidence that are needed to make the best decision making at a government level. To be able to do that, we have several different mechanisms, and in terms of in times of pandemics, all of this needs to happen at speed light, and then we really need to bring all of our efforts together. So that means that we already need, from a government perspective, several mechanisms in place. So when the pandemic strikes us, we're ready to go, and we're ready to go quickly. So in terms of being able to mobilize funding, we have at CIHR what we call the Emergency Health Threat Research Fund, which is a $5 million envelope that can be mobilized as soon as we identify a health threat coming for Canada. So those envelopes have been identified previously I've been used previously through the Zika, Ebola, the opioid crisis, and then the wildfire. And then as soon as January, we were already monitoring in CIHR to activate this research fund, knowing that there would be a need for research and answering research questions, and then get that money out of the door very quickly. We also found a Canadian Immunization Research Network that has a built-in structure for us to tell them, here, there's a pandemic, we're going to activate this extra funding, and then it's going to go to you, and then you're going to have to answer specific questions of public health interest. So that's also existing. So within few days or few weeks, we can request from the Canadian Immunization Research Network to address very specific questions that we have identified as being extremely relevant. And then in terms of international coordinations and how we identified what are those needs and those questions, we sit on a very specific national and international task force that allow us to monitor and understand those landscapes. So for example, we've been sitting on the Vaccine Research Innovative Development, which is a national table where we can understand what all of the different actors that would play a role in vaccine development for COVID-19 in Canada, for example, where they are, what are the capacity, what are our manufacturing capacity in Canada, and then we can rapidly understand that and then fund our research response. And then finally, we sit on consortium of funders, which helps us really coordinate with other funders. What are you going to fund? And then so we don't duplicate effort, and then we synergize between us. So going to this idea that it's a very international answer, and then there's so many questions that need to answer. It's very important for us to say, okay, so in Canada we have this capacity, and then we can do this. We can fund this specific aspect, and then so we speak with other countries through different consortium, and then they say, well, we will take care of this part. So Globetrotter has been a mechanism that has been extremely important for us in this response to be able to get that international coordination and understand where this at. So in the next part of this presentation, now that I've provided you with the context, Charu is going to dive in and really explain to you all of the different aspects of that. So Charu, on to you.
Thank you, Geneviève. So that should give everybody an overview of sort of where Canada lies in this landscape and what are the different parts of the Canadian government response that are involved in pulling together an all of government. And we are today just speaking of the health, science, and research parts of this response. We're not getting into all of the international as far as the shaping the policy for immigration, international travel, or the economic part, which are, of course, interrelated. Our focus is primarily on the health, science, and research parts of the Canadian government response. So I'm going to dive into a little bit more details of what Geneviève outlined on that timeline that you saw in terms of what the Canadian government's research response was. So far, Canada has put together and launched two different phases of science and research-related responses. The first part was in the acute phase, or preparing to deal with the pandemic arriving in Canada response. So you'll note that in this slide and in the next couple of slides, I'm going to talk to you about the kind of opportunities that we provided for our scientists and researchers to look at the broad landscape of what's required to prepare for the pandemic and deal with the pandemic. So this phase one opportunity, which was launched in January, and we provided some of the timelines to show how quickly that was turned around. We had a number of multiple partners, federal, provincial, and in the first wave of this funding, we provided 47 grants for $27 million. The numbers of the grants and the dollar amounts are really representative of what a government response the size of Canada as a country looks like. For people who are from listening around the world, that needs to be scaled up or scaled down based on sort of specific governments that are dealing with this. So the Canadian government's first response was about $27 million for research. We realized quickly that that was not quite sufficient based on the response that we received and what we were able to fund. Along with the research grants that were first provided, there was also an immediate activation of the immunization research network, recognizing that this was going to be an important role. So this was in the dollar amount of $1 million, which I'll talk about this later, that in the second phase, how these have been shored up to make it appropriate to the level of response that we really need. So next slide. So in addition to the first wave of research response, there was another $275 million that came out that was really required for or put in for support for innovation. So examples of what that $275 million package was divided into include the $192 million for Strategic Innovation Fund. What these are for is for large-scale projects that can deal with population-based interventions based on Canadian innovation. So that one of the thoughts underlying this was that Canada needs to be self-sufficient because it was becoming clear as the pandemic was gripping different parts of the globe that countries are starting to look more inwards in terms of resources and becoming self-reliant. So this was an attempt to make sure that there was enough innovation within Canada to be able to allow us to take care of our needs for the pandemic on our own. So many of these, including the $23 million for vaccine and disease organizations, the digital health for supporting monitoring and modeling, as well as the scaling up of GMP-sized facilities where vaccines could be manufactured are part of that attempt. The second phase of providing direct money to research was also in part of this $275 million. As I said, the first phase looked like we had a lot more very good ideas from researchers and scientists. So in total, about 99 million or 99 grants were funded for about $54 million. Next slide. So the federal government was not the only part of the response. On this slide, we've tried to highlight that there were many institutional level, provincial, federal government, so the whole of Canadian research enterprise and science enterprise has come together. And this gives you an overview of the type of investments that were put in by multiple other federal partners or provincial partners, even institutional level. We are seeing all over Canada, there's been more than $75 million that have been invested by provinces, universities, and nonprofit sector to pull together for providing research and evidence-based information for the government and for the general Canadian public. Next slide. Next slide. Right. So I'm going to talk a little bit now about the international research response, starting from the initial participation of Canada at the WHO Global Research Innovation Forum that was held in mid-February. Now, just as a reminder, this was the time in February where the pandemic, or at that time it was not a pandemic, the epidemic was primarily focused in China. And WHO wanted to bring together governments and researchers and scientists from all across the world. And being part of the GLOPIDAR, which is a consortium of research funders that are focused in peacetime on infectious disease preparedness, and Canada and the CIHR actually sits on this body as one of the co-chairs, which I represent. We actually provided help in order to bring this innovation forum, research and innovation forum together. So it was co-chaired by WHO and GLOPIDAR, sponsored by many funders, including CIHR on behalf of Government of Canada. More than 400 scientists, public health experts, and funders came together, including participation from many Canadian researchers and including CIHR. Next slide. The outcome of this was basically from the, interesting, this is an animated slide which should actually be showing in the background. The WHO in peacetime has put together an action plan, or what they call the R&D blueprint for preventing epidemics and pandemics. And in the background, what you would have seen is that actually the WHO forum that was put together informed the coordinated global roadmap in the context of COVID. And what you're seeing in the foreground here is that the highlighted parts, or there are 8 or 9 different areas of priorities that emerged from this WHO forum, which resulted in identifying research and development and science priorities to address the COVID research. And highlighted in the yellow are what WHO Forum informed and how it informed the Canadian plan to launch research in these areas. So Canada was able to align its research priorities based on the WHO roadmap for COVID-19. Next slide. Can we have next slide? Thank you. In terms of the Canadian alignment, this is how it panned out. In the first round of the response, we were able to fund both medical and social countermeasures, the two different sides, and shown in detail are the percentages in terms of funding and the number of grants that were funded in specific areas that align with the WHO priorities. Next slide. So that was how the overall international coordination informed the response for CIHR and the Canadian government. The next couple of slides actually show what Canadian contribution is to this international efforts. And again, this is representative of how that global coordination back and forth needs to occur in the context of a developing pandemic. So as I mentioned, that Canada was able to, can we go back to the slide? Thank you. So basically, Canada was able to contribute to the GLOPADA-R initiatives. It was also able to participate in the UK CDR, which is a live research project tracker, which shows what are the areas according to WHO priorities where the funders have been able to fund. So it identifies both research opportunities and areas of synergy and coordination, but it also helps to identify funding gaps and where international governments can focus on gaps that are present. Next slide. This is then an example of how both international responses are informing domestic responses for governments and how domestic international or domestic governments can respond and help coordinate international response. And mentioned on these slides are examples where Canada is contributing to the WHO coordination in terms of the trials that are running out of WHO, the Solidarity 1 and Solidarity 2 trials. Next slide. So I will transition now to very fresh stuff. This slide was put together yesterday because this announcement just came out yesterday. So the Government of Canada announced yesterday a $1 billion investment in the second phase of the research response, research and science response. And shown here is a detailed list of what was included in that, and that included everything from $115 million direct investment into CIHR, allowing development, testing, implementation kind of research that CIHR will be investing in. But it also includes a number of smaller packages and larger packages, which is focused on innovation, establishing immunity task force, which will look at seroprevalence studies, genomics, mental health, a number of other things that are included in this package. Next slide. Along with that, next slide. Yep. So as Geneviève pointed out, can you go back to the other slide, please? One more. Thank you. So as Geneviève pointed out, the research is showing up to be really, really important in this pandemic because the research and science is what is informing the public health responses, health system and clinical responses, as well as policy. And shown on the right are a number of national and international platforms that are really used for knowledge mobilization so that research information is quickly put into practice in terms of informing public health policy as well as clinical response. Next slide. One more. Thank you. So I'll finish up with this perspective, not so much of lessons learned, but of what we are recognizing and lessons that we are learning even as we go forward. So the previous talk that you heard was on the historical aspects of a pandemic. If you look at the 1918 flu pandemic, which was the last large pandemic that swept across most of the world compared to this pandemic 100 years later, this is a very different pandemic. And what we are learning is that we need to handle it in a very different way because it's a global enterprise. As we tried to go through and explain to you that there's a lot of back and forth between global coordination and national coordination. There are models such as the CEPI model. I'm sure most of you have heard about the vaccine initiatives coming out of CEPI, that they are the kind of models that move away from market-based dependency for vaccines into more equitable distribution for vaccines. And the acceleration mechanisms such as the WHO blueprint, the GLOPIDAR, as well as open sharing of science. The other unique aspect of this pandemic has been the communication. It's a very different communication. This is truly a 21st century pandemic where information, both good and bad, are being shared instantly. And while we've seen many good examples of data sharing, which have allowed countries who were lucky enough to have a few weeks to prepare for this pandemic, at the same time, there's a very rapid outbreaks of misinformation as well. So again, we are learning lessons from this in terms of how we should be dealing with the rapid dissemination of information. The final 2 points I want to make are the values that are coming through in this pandemic. You know, in peace times, many governments, NGOs, and other agencies talk about equity, global access to solutions, and other you know, values that are important to keep in mind. But how those are playing out are being watched by millions of people every day, and we will be accountable, and we will have to come back and think about these aspects and how to deal with this moving forward. And the final piece in terms of, I think most governments and public are realizing how important preparedness is in terms of being prepared for a pandemic like this. You know, none of us in our lifetime have ever dealt with anything like this. Hopefully we are not going to. 100 years ago, people dealt with this, but they were not prepared and they had no information. There really is no reason now not to be prepared for something like this to come through. And we have had a really good chance to learn our lessons because the next pandemic that comes out may not be maybe much, much more to deal with than the current one is. So all of these are big lessons for us to learn in terms of making sure that we are ready and stay ready and sustain those. I'll stop here.
Thank you so much, Charu and Geneviève, for a fascinating presentation that clearly illustrated the severe complexity of the response of CIHR and the Government of Canada. Thank you so much for that in helping us understand a little bit more about what you've been dealing with hour after hour, day after day. The first question is coming through, and everybody please continue to submit your questions in the chat section. What's the difference between COVID-19 and SARS, MERS-CoV that has led to this world pandemic this time? Can you help us understand that a little bit?
Yeah, so I can start off, and then I'll ask Geneviève to add in her perspective. So I've been asked this question quite a few times. So, you know, in the case of SARS, the infectiousness of SARS was much less than the current. We know now that asymptomatic people are very much part of the reason why the current pandemic is spreading, which was not well understood. So, of course, we're learning the new things that are developing with this virus. In the case of SARS, most people who were highly infectious were very much symptomatic and severely ill. So in some ways, this virus not being as severe and symptomatic has led to much faster dissemination. In the case of MERS, there was a very limited outbreak that was controlled. Again, that is, you know, true for outbreaks like Ebola and other outbreaks where they were, again, SARS in 2004 was very quickly contained. The problem with this virus, you know, some of the problems have been that it has been under the radar and is continuing to be under the radar. So even now, we don't know what % of the world population or even countrywide populations are actually infected, because we are only dealing with people who are sick or very sick, and that's only a fraction of people who have been exposed. So the virus is spreading under the radar.
Okay, thank you very much for that. If we could probe that a tiny bit more, I can remember SARS. We said at the time that we would be prepared for now the next pandemic. And we're hearing the same thing now. With the lessons learned, we're prepared for the next pandemic. Can you help us understand a little bit about how the seems to be a bit of a, we're continuing to say we're prepared for the next one, but then we're not. Can you help us understand that a little bit?
Yeah, again, you know, this is something that I've been asked a few different times. And, you know, governments prepare, WHO prepares. That's why there are so many ongoing, you know, organizations and forums at which this sort of thinking goes into. Are we better prepared than we were for SARS in 2003? I would say yes. The Public Health Agency for Canada, for example, is a creation from the lessons learned from that outbreak, where we were caught completely by surprise and the inability to coordinate between different branches of the government. So we just showed you all the examples of how, at least on the Canadian government side, the response is much better coordinated. You know, could we do better? There's always better. You know, so even for WHO, I'm sure many people are looking at the criticisms of WHO. So when a pandemic takes the scale that this pandemic has taken, there's always questions around, could we have done better? And hindsight is 20/20, and most people would say if we had known it would be this, the scale that it is, we would be. But it's also not true that there was no preparation. There has been preparation, and you know, I just gave examples of the coordination. The R&D blueprint that is coordinating a worldwide research effort came into being after the Ebola outbreak of 2014, which, as you know, led to thousands of deaths. So, so there are lessons learned, but of course, if you look at the wide scope of things, you know, governments and public are dealing with problems all the time. So here in Canada, examples of those are the opioid crisis. You know, in the last 3 years, that has occupied a lot of time and effort on behalf of the government, and it has been front and center for public as well. So you, that balance needs to be there in terms of what's going on. But yes, we are learning our lessons at this time. Geneviève, did you have anything to add?
Yeah, I just wanted to add to what you're saying, Charu. I think another thing that is always a problem in terms of maintaining this preparedness is the capacity to sustain some of those infrastructures. And then we're thinking, for example, in low and middle income country. So having a continuous capacity to do surveillance or when a pandemic comes in, to be able to redirect some of those resources, or even being able to do some of that research. So sometimes we have to scramble and then bring back some infrastructures or capacity together, or even build them because they are not existing in Canada. And then we're seeing that right now in Canada with some of the vaccine manufacturing capacity that are receiving right now money to expand or to be built. So the next time, as we're learning from these lessons and then getting some of those infrastructure, I think a big lesson learned is how we can maintain that funding and maintain those capacity and those infrastructure. So when pandemics comes, then we're more ready. We don't have to scramble to bring all of these resources together again and this capacity.
Great, thank you both for those. This question that's coming through now, and they're flooding in, is more specific around the same theme. The person indicates, I really like the presentation, thank you. I wondered if any research collaborations that evolved during the Zika outbreak are now used again for research into COVID-19. So let me just repeat that. I wondered if any research collaborations that evolved during the Zika outbreak are now used again for research into COVID-19.
So I can start off. So, you know, we are, of course, reformatting or developing tools that are already there. So research collaborations across LMICs, for example, discussions around the infrastructure that was developed during Zika, during Ebola outbreaks in South America, in Africa, whether those same infrastructures can be used for dealing with COVID-19 is a really important area that many governments are focusing on, and WHO has been coordinating as well. So the short answer is yes. Specifically in terms of Government of Canada, are those being restructured and directed to use these? We would have to look up whether that has happened. But we fund open research. There's nothing that stops people from reformatting their networks or research to use towards COVID.
Thank you, Charu. I just want to slip in one quick final question, and then we'll have to wrap up. This one moves you into the future. There have been rumors that a second surge of COVID-19 will likely occur in the fall. How does the CIHR prepare for this type of unexpected recurrence of a virus?
Yeah, so that's a really good question. Usually I will direct this to infectious disease specialists to, but given that the question is how CIHR can prepare, so the phase 2 funding that has been rolled out is with very much this in mind. Keeping in focus, where is the pandemic playing out in Canada right now, and what information do we need for moving forward? So if you look through the announcement that came out yesterday, there's about $350 million funding there for a Canadian Zero Prevalence Consortium with the appointment of a task force that is specifically devoted to answering questions around understanding better among the Canadian population who is resistant to the disease, who has good immune responses, in what order can people go back to work, and what do we need to know to keep the pandemic under control. So we are already looking into that, and hopefully we will have good answers in the next few months to be prepared should that happen.
Thank you very much. I want to thank Dr. Kaushic and Dr. Boily-Larouche for responding to the questions, and I want to thank the participants for those compelling questions. The ones we didn't get to will be on the website, that we hope that our speakers will be able to respond to those there. And now I'd like to quickly wrap up the webinar. We hope the information provided was relevant and useful in your understanding of pandemics. And thank you all for attending today, and a special thanks to Charu Kaushic and Geneviève Boily-Larouche for an excellent presentation and the insights in the Q&A. We look forward to hosting a third webinar entitled The Development of Vaccines in Pandemic Planning. This will be held on Monday, April 27th from 10:45 to 11:45. It features Dr. Luis Barrero, a Global Health Advisory Board member at McMaster University, an award-winning consulting specialist in vaccine development. In this webinar, you'll learn about the practical ins and outs of innovations in vaccines for use in pandemics worldwide. If you haven't registered for Webinar 3 or for other webinars in the series yet, please register through the link on the website globalhealth.mcmaster.ca 2020 webinar series. So enjoy the rest of your day, everyone. We look forward to your participation in our next exciting webinar. Thank you. Merci. Gracias. Dank u wel.